Hello everybody, recording live from somewhere. This is Zach Couples with episode number 73 of the Movement Debrief. And tonight, folks, this debrief is going to be on that separate excrement, yes, that other shit. We're going to talk about basketball player ankle mobility. How do you get these beautiful, sexy, outstanding basketball players to not just be on their tippy toes all the time since they're jumping all types of wild and crazy? Can you get them to dorsiflex? Stay tuned. We're going to talk about cosmetic dentistry. What's the difference between doing a little bit of that and a little bit of, oh, I don't know, making your face all good and whatnot so you're not just got pretty teeth? Stay tuned. I'll talk a little bit more about that. Not to be confused with cosmic dentistry, Tyler. Last but not least, we're going to talk about the transfer of breathing activities. Yeah, you're doing all types of cool stuff on the table, but guess what? I got to live life and it's not on the table. What you going to do about it? I'm going to tell you what I'm going to do about it, because these are questions that are asked from the people, answered for the people, by this people, fam recognized fam. Without further ado, let's debrief, shall we? The first question comes from my boy, Rod. Rod asks, how much can we really change ankle mobility in high-level hoopers? Whew. This is a multifaceted question. I'm really glad that Rod asked this question, so thank you for asking. It depends on a lot of factors. Let's assume there is no, well, actually, let's not assume. The first thing I would say, with ankle mobility and basketball players, especially at the high level, a lot of these guys have been playing for a hot minute, probably got a little bit beat up on the way, might actually have some bony adaptive changes that have occurred at the ankle joint or at the big toe or something on the dogs. That can have a profound influence on ankle mobility. We have to first take that into consideration and realize that that could be a potential rate limiting step that we might see with our basketball players. Let's just say, for the sake of argument, that we have ruled that out as a potential rate-limiting step for ankle mobility, and we have these basketball players who are jumping all day, all night, calves be on fleek because they have to be in order to play their sport. Is there something that we can do that might help them with their ankle motion? I would have to say, based on my experience in the NBA and the D-League, yes, tentatively. I don't think that we are going to make drastic changes that might be seen or realized on the floor from an ankle mobility standpoint. But what we may do is we may give them complementary activities that contrast what they're doing on the floor, that put them into positions where they might explore ranges of ankle motion that they don't normally utilize when they're playing. The big, most important move that I would say for these guys to express that ankle motion is working on squatting. Squatting is paramount because if you're squatting effectively, you're shooting the knees forward while keeping the heel contact. That's going to maintain good ankle motion. Life should be good. The problem with a lot of these guys is not just ankles, but if they've had knee issues in the past, most basketball players have a very hard time pushing the knees forward. That's going to be essential to keep the pelvis underneath their thorax as they descend down into a squat. Most of these individuals, for wherever the limitation is, are going to have a greater tendency of shifting the pelvis backward, a hinge pattern. This is not good for a lot of reasons. Aside from squatting, you're not going to be in the best defensive stance if you can't drop down and drop your pelvis straight down. So being able to get our individuals to squat with the pelvis in more of a posterior tilt as they descend down, shooting the knees forward, is probably the most effective way that I've seen us improve ankle mobility in these higher level individuals. Does it transfer? I don't know. If you want to learn more about the squat, and I'll link it in the show notes, but I have a whole frickin' video on the squat. It's called Squatting Bar Reach Movement Deep Dive. You'll probably want to check that out into further detail. But the biggest things that I've been focusing on as of right now is ensuring that as someone does squat, that they maintain posterior tilt of the pelvis. you drive a little bit of sacral counternutation as well. That also helps reinforce the posterior orientation of the pelvis. The cue that I got, and I have to credit Daddy O'Pops for really opening my mind, Bill Hartman, I'll link him in the show notes too. He's really made me think differently about squatting. But just simply having someone squeeze their cheeks together, or as I like to tell people, you had a bunch of tacos, they were heavy on the beans, you don't want to embarrass yourself in front of me, hold in some gas. That works really well because you are taking some of the muscles that attach to the sacrum and the coccyx, and you are actively contracting them to create sacral counternutation, which is essential as you work squat depth. If you can do that, as well as cueing them to push their knees forward, life's good. Now, with some basketball players, their ankle mobility may be restricted to a degree where squatting flat is but a dream. For these people, simply get a ramp. If you can get a ramp and still teach them to push their knees forward, that's going to help them restore ankle mobility within their current constraints. The eventual goal, if your goal is mobility, would be to reduce the amount of the ramp, so they're getting more and more progressive ankle dorsiflexion, and that's assuming that they can keep the pelvis stacked atop of the thorax. If you reduce the ramp, and you notice that they start tipping the pelvis back, i.e. they're hinging more than they are squatting, then you know you've probably pushed them too far. That being said, if the goal is loading, I might actually keep them on the ramp and not focus so much on restoring the ankle mobility aspect of the squat. That would be what I would recommend as probably the top move that you can coach your basketball athletes to do to restore as much ankle mobility as possible. Once you've done that, and that's starting to look pretty good, you would simply progress the task to more challenging and complex activities. So that might be starting with a low-level squat activity, such as the squatting bar reach, or I'll link a few other lower-level activities, squatting activities I like. You could do that, progressing it to front squat, safety squat, whatever your terminal exercise is, and then applying similar principles with jumping and landing mechanics. For my jump progressions, I like utilizing jumping up to a box just to minimize the distance that they have to land, slowly working towards maybe hurdle singles and then doing hurdles continuous. But if you do those things and you can teach them to land effectively and maintain the same stacked thorax and pelvis positioning that we attempted to do on lower level activities, you ought to be in business from an ankle mobility standpoint. So to summarize, you can improve ankle motion in your basketball hoopers at a higher level, assuming that they don't have structural pathology. All you got to do, in my opinion, is squat the snot out of them. You can do some local ankle work if you like. I haven't found that if you can get someone to squat pretty good, you don't have to do that as much, but do some local ankle work, do some squatting, progress that to higher level squats, use a ramp as needed, progress that to jumping, and you'd be surprised at how much ankle motion can improve. Rod, awesome question. I'm so glad you asked it. Jumps, put that in there too. The next question comes from my boy, Tyler. Tyler asks, I'd like to hear about Invisalign for cosmetic purposes versus a dental appliance for health purposes. Tyler, great question. The crux of Tyler's question involves people who go straight to bracing versus people who may utilize other appliances or treatments to maximize facial growth or maximize the dimensions of the face. What is the difference between these two things? In the former case, where you're using just straight up Invisalign without addressing any cranial structure, that is simply to make your teeth look straight and pretty. That's it. This can be undesirable though, even though you might be looking good, although maybe not, stay tuned. This may be desirable from a cosmetic standpoint, but what it might not be desirable for is the airway. Let's dive into that. So you have an airway, and I'll link a picture of it if you haven't looked at the upper airway because it's kind of a big deal. But in a perfect world, you would have a relatively expanded palate that is U-shaped, You would have a clear nasal passage. You'd be able to place your tongue in the roof of your mouth. That way you can breathe in through the nose. That air is a little bit purer. It's a little bit more protected against pathogens because you have the nasal airway, and it's got a lot of things that would protect against that. So we want to make sure that the airway is clean going in through the nose, that we can block the oral airway from taking in too much air, one, and also that we have enough space within the upper airway to get enough air, right? That's important. That can be problematic, especially in something such as sleep apnea. We have individuals who have sleep apnea because the airway has closed for some reason. Here's the deal. With a lot of people, there's this concept called a mid-face deficiency. What that is it's where this portion of your face, so from the maxilla towards the mandible, is retruded back. In a perfect world, you would have the orbit, so the top part of your eye, and a straight line going down and touching the maxilla, in theory. Most people don't have that because of a lack of breastfeeding, poor diet growing up, also probably some genetic factors, among other things. This has a few negative implications from an airway standpoint. One, the space is reduced on the airway because the palate is shrunken A to P, or front to back. You can also oftentimes have an elevated palate, or a high palate, where the dental arch is narrowed medial laterally. This might lead to crowding of the mouth. Also, reduced front to back dimensions of the palate can also lead to mouth crowding. That's more me. These factors can reduce the space on the airway. And that's a problem, and that's not something that's going to be addressed if you go straight to braces. In a perfect world, you ought to have those dimensions expanded so the airway space is much greater. And if the airway space is much greater, you can get better oxygenation to your body. That can help with sleep. That reduces the risk of obstructive sleep apnea, which if you're not sleeping good, you got problems. Invisalign is not going to take care of that in most cases if it's done first. Now, I must preface, in terms of specific appliances that I recommend, I'm not as well versed in this as I need to. If you want a better guy, if you look at Daddy O-Pops, Bill Hartman, or Joe Cicinelli, I know he doesn't put up much content, but he's a smart dude. Those are my two experts. But what I do know is that ideally, you want to try to first bring this forward from a structural standpoint before you do bracing, or at least maximize the dimensions within whatever is possible with you. That would involve reducing the mid-face deficiency. I'll link that in the show notes as well to learn a little bit more about that. There's actually, if you go to Google Images and you type that in, you would be amazed at what some of these appliances and surgeries can do from changing facial dimensions. And if we want to talk about cosmetics, you'll see the difference between how these people look pre and post intervention. It's pretty dramatic. Because guess what? You might have straight looking teeth, but if you have a crazy underbite or a crazy overbite or an underbite, that ain't sexy. But if you got your mid-face deficiency fixed, that is sexy, if you know what I'm sizzling. So ideally, you want to restore those dimensions. You also want to have a functional nasal airway as well as the ability to block off the oral airway. That's where going to an ENT who maybe fixes any septal deviations or enlarged turbinates is big. Generally, if someone's going to go that route, I recommend that they look for someone who does turbinate reduction as opposed to taking the turbinates out. Because what can happen is if you take the turbinates out, you can run into this problem because of the anatomy changing in your nose called empty nose syndrome. That is not good, because what actually happens is the symptoms that you had pre-surgery of not being able to breathe in through your nose are maintained after surgery. No bueno. That seems to happen more when the turbinates are taken out as opposed to the turbinates being reduced. Another thing, which is what I just got, would be a frenuloplasty. That would be removing the frenulum if you have a tongue tie, so you have an increase in mobility. I had that done 2 weeks ago, and I'm already noticing qualitatively some pretty nice changes in my sleep quality. And I also have some interesting data on the Oura Ring that shows that I'm trending in the right direction for that as well. Stay tuned. I want to get a little bit more long-term with that, along with myofunctional therapy, to see what changes we get. But once you have that functional piece in place, then you may be warranted in doing some type of expansion of the face, as opposed to going to straight braces. This is different from just doing a flat plane splint or a gelb or something where you're just bringing the jaw forward and down. Those really aren't going to do piddly diddly from a facial dimension and airway standpoint over the long haul. What likely has to happen is some type of device or some type of surgical procedure to alter the facial dimensions in a manner that maximizes the airway. Some of the appliances that I haven't used personally, but I've had colleagues either use this with patients or use this on themselves with good results, would be an anterior growth guidance. That would be one. What that in theory does is it brings the face forward by basically stimulating a nerve in the palate that leads to bone growth, A to P. That's one possibility. I also have a friend who's used a Crozat appliance. I believe that does some expansion medial lateral. That's also another possibility. The ALF is another thing that also does medial lateral expansion only. The only downside about the ALF is you're not going to get that anterior expansion of the face. So there's those things as possibilities if you need them. The most aggressive, and I'm actually really intrigued by this one, would be getting a surgery that involves, I think it's called the maxillomandibular advancement surgery, and I'll link that in the show notes. And guess what else I'll link for you jokers who think that, oh, that breathing, it doesn't matter. False. This actually has some pretty solid research on improving sleep apnea, this particular surgery. I don't have sleep apnea, I don't think, but it is something that I'm looking into just because I'm curious about it, one. But also anything I can do to maximize my ability to breathe and sleep is something I'm going to do. It's definitely something I'm going to look into. But I'll also link the meta-analysis that goes over just how profound this surgery can be from a airway standpoint. So those are your options. Once you have the dimensions in place, then if you want to use Invisalign or braces, that's probably going to be your better bet. Because if you do that, then not only are you maximizing your airway, one, two, you're probably going to have better contact teeth-wise, which can help you from a mastication standpoint. And three, you're going to look hella pretty because you just don't have these nice looking teeth, but you also have a face that matches where the teeth should be. The worst thing you can probably do is do some type of cosmetic thing where teeth are going to be pulled because these are bones. We use them for sensory awareness of the neck as well as our other senses. That's something I try to discourage people from doing unless it's wisdom teeth. That's probably the only one example because in some cases the wisdom teeth may come in impacted, especially if you haven't had those facial dimensions there from the start. That can alter your occlusion. And in my case, when I had my wisdom teeth taken out, and I'll link that story in the show notes, but I couldn't move my jaw side to side. Once I got the wisdom teeth out, it was crazy amounts of motion. So that's also another thing you may consider. To summarize that, cosmetic versus health dentistry, the top priority for me is you want to make sure your airway space is maximized to the nth degree. Because if you're not getting air, that could potentially be impacting sleep. The negative health implications that happen with sleep deprivation are well documented. And you should probably do everything in your power to maximize that. What you need to do is likely expand the front of the face as well as the lateral dimensions. That can be done a multitude of ways. Things to consider would be making sure your nasal airway is in check, making sure you have excellent tongue mobility, making sure the wisdom teeth are removed if those are impacted. All of those can influence the functionality of your airway. From there, it's all about rebuilding structure. That might be involving certain appliances that either bring the face forward, which is muy importante, and expanding yourself laterally. Once you've done all those things, Invisalign away, it takes a little bit longer, or you can go straight braces. And if you do either of those things, you will be in business and you will look pretty, Tyler. You'll probably look prettier than if you just got braces. So, Tyler, great question. I'm excited to dive more into this kind of stuff this year because I think it is incredibly important. And just seeing the positive effects myself, I don't know nearly enough. I don't know enough to make specific recommendations for people, but I think it's going to be a very important thing for a lot of people to do from a health and wellness perspective. So, Tyler, awesome question. That was a doozy. Last one comes from my boy, Andrew. Andrew writes, how much do breathing and sensory-based exercises actually impact anything outside of those exercises and transfer to life and sport? Andrew, that's a great question. Let me see what I could do to answer that question. Well, the short answer is we simply don't know. I understand that, we simply don't know, but we have to look at what we are trying to do and attempting to do with these breathing activities. When I'm programming stuff, my goal, my intent is to restore movement variance. That is, if an individual in a specific context does not have all of the available movement options at their disposal, I'm going to get them that. There's a big difference between getting that on the table and getting that in standing. From my standpoint, though, we have to start somewhere. If you are going to be learning the piano, as a prime example, maybe you want to play Beethoven, but that's not where you start someone. You probably start someone with chopsticks or something very easy. Okay? Now, are those things going to help you play Beethoven? Probably not. But you have to have those fundamental principles in place first before you go on to the fancy stuff. I think of the same thing happening with a lot of the respiratory-based activities that I program for people. When we are driving a specific quality, maybe that is the squat like I was talking about, and I'm just encouraging someone to posteriorly tilt or counter-nutate the sacrum. That's going to be an essential component that they might not pick up right away in a squat. So if they can't do it in the squat, I need to break that down to an easier context. And then maybe I'm going to bring them back and try to educate them to perform that same action in the squat pattern. And I think that you would progress that on and on and on towards more advanced activities. In some cases, I oftentimes will see things transfer very quickly, but I think that's very idiosyncratic. For myself, for example, when I'm doing activities on a lower level to improve my ability to expand in my upper thorax, I oftentimes see an immediate change in my ability to go overhead as well as my ability to press, both in feel and in look. It's pretty dramatic. Did I just do a bunch of activities that work on overhead? No. In fact, with my resets that I do personally, those don't put me overhead in any of those specific positions. I mean, I do a toe touch variation, I do something to expand the upper thorax, and I do a sit-up to get more posterior expansion. And those three things, for me, transfer to my overhead press. Will that be the case for someone else? I don't know. Maybe that's the wrong move. Maybe you actually have to find an intermediary between those two things to create that transfer. Or maybe you just have to practice the activity itself. It depends on what is the rate limiting step for that individual that is impeding their ability to perform a specific motor pattern. That's the biggest key. I don't have a good answer in terms of if it transfers for everyone, because it may, but it may not. But what I do think is the case is the ability to expand and contract the ventral cavity, thorax, abdomen, and pelvis as a unit is something that is consistent regardless of what you're trying to do. We always have to breathe in and breathe out. We always have to pressurize and expand that cavity with any task that we do, maybe unilateral in some cases. And we have to start somewhere when we're teaching that. Can some people get that at higher activities? Sure. If that's the case, then maybe you don't have to do some of the table-based stuff. But I find that by doing some of the lower level stuff, it helps provide context, awareness, and maybe it gives them that baseline degree of movement options to be able to perform their tasks at a higher level. So to summarize, does this transfer? It depends. It likely depends on the person. Some people will pick something up at a lower level and they'll be able to apply it at a higher level. In some cases, you have to use that lower level activity and then grade yourself to more and more challenging tasks in order to create the movement transfers that you desire. Andrew, great question. And I think that's a good stopping point for us tonight. I want to thank you all for tuning in. I do have a couple housekeeping things before we go. The Human Matrix schedule, Human Matrix is about filled for this year. I might have one more in the books, but I want to tell you where I'm going to be because I want to see you there. If you want to learn more in depth about some of the stuff that I'm talking about, like the transferring of these movement tasks, squatting, all of that wild and crazy stuff, you'll want to attend Human Matrix. There are several dates. We have only a few spots left. February 2nd and 3rd, New Providence, New Jersey. We have a new one, May 18th and 19th in San Antonio. All my exes live in Texas. June 8th and 9th is going to be in New York City at Pat Davidson's place, Hype Gym. What you going to do about it? Excited about that. Then we got August 3rd and 4th in Cincinnati. We got August 24th and 25th in Vancouver, BC. We got September 21st and 22nd in Raleigh, North Carolina. October 5th and 6th in Boston, Massachusetts. And December 7th and 8th in Orlando, Florida. You can bet your bottom dollar I'm going to be going to Universal Studios while I'm there. So that's what I have on docket for presentations. I would mention the Revolution, but it's sold out. Sorry. You're not going to be able to see myself, Pat Davidson, and Seth Oberst unless you're already there. If you are, I'm pretty juiced up that you're going to be there. I'm also, I think there's 2 slots available for the functional medicine thing, or the retreat in March in Costa Rica at Ben's place. You'll definitely want to check that out, and I'll make sure to link that in the show notes. The S&C week, unfortunately, is booked, which is what I'm going to be speaking at. Other things, if you want to learn more about me, because I got a bunch of information out there on the interwebs, go to zachcouples.com. While you're there, you'll want to sign up for my newsletter. In my newsletter, you're going to get 4.5 hours worth of free talks, breathing and pain related. You're going to get a free acute to chronic workload calculator, and you'll get goodies from me every Friday if you want to know what's going on the interwebs. I can be your guy. I also offer 3 services online. Movement consultations. If you're throwing, you're not moving as well as you'd like to, or maybe you've ruled out the big bad stuff and you want to know, hey, if I move better, maybe that can help me. I'm your guy for that. What we'll do is I will take you through my assessment online. We'll do some activities, make sure we get some changes in that movement assessment, which can hopefully help you get closer to your goals. I also offer mentoring. Maybe you want to learn how to apply the squat to your people, or you want to build that transferring capacity with your clients on this low-level stuff to the high-level stuff. I'll be your guy. We will have a great back and forth discussion. I can even take you through some moves to make sure that you are doing them correctly, because if you experience it, you're going to figure out how much better you can coach your people that you want to improve movement with to help them meet their goals. The last thing I can do for you is training. If you want to get straight gains, if you're post-rehab and you're unsure how to do that graded activity that we talked about earlier, I will do that for you. We will take you through a movement consultation, address your movement limitations, and tailor your program specific to your movement needs so we can get you to your goals in the best plan possible. Once you've scoured ZachCouples.com, you'll also want to sign up for me on iTunes and Stitcher at the Zach Couples Show, because guess what, folks? There are 72 other debriefs. Do you really want to look at me for all of them? I don't blame you if you don't. You want to take me on a long car ride, though, if you sign up for the Zach Couples Show on iTunes. I'm hoping also this year to have more shows available, so stay tuned for that. Once you've scoured ZachCouples.com, you signed up for me on iTunes, you left reviews, you'll want to find me on social media. I'm on Facebook, Facebook.com/ZCouples. My Twitter handle is @ZCouples. I'm on the Instagram, baby. And the quote board is back, folks. That's Zach, Z-A-C, Couples, C-U-P-P-L-E-S. And last but not least, you can find me on YouTube if you want a plethora of activities or you want to see what am I doing with my peeps right now. Search Zach Couples on YouTube and you'll find me. Thank you so much for tuning in. You've been an amazing audience. I appreciate each and every one of you. Keep it real, but not to the extent where things go wrong. Stay hungry, stay learning, stay moving, and I'll see you next time. Deuces.